the care that I'm getting is unsatisfactory, and I wanted to speak to someone there.
Are you are you at a unit now?
No, ma'am. I'm laying on my bed right now.
Okay. When were you discharged?
Uh, I came down there Friday expecting to be put in the hospital, and they sent me to the NASA clinic, and they told me that my doctor was off, and uh, they would see me a psychiatrist at 1:30 in the afternoon. So, I don't know what's going on. I talked to the patient advocate about getting a new doctor, and he said he would call me back, and he never called me back. And I complained about the level my care, and they sent me back to the same doctor who put me in this position in the first place. And I don't know, it's
The
like I'm in a big
physicians
circle.
report to the chief of staff office, which is Dr. J. Calabar. So if you have a concern with your physician, your call will be directed to the chief of staff's office, who oversees the physicians here.
Okay, and who oversees the clinic?
The chief of staff's office. The chief is Dr. J. Calabar.
So, like, if I was told by the lady making my appointment that the Veterans Choice Program people would call me to set up an appointment, and they never did because my paperwork was filed incorrectly, who would I speak to about that?
The Veterans Choice, they have an advocate that's in the eligibility department.
Yeah, ma'am. And I tried to call her for 2 months, and ended up and the Veterans Choice people ended up calling 911 and having an ambulance come over here and pick me up and take me to a hospital over here.
Well, what I'm doing, I'm answering your specific question. You're
Uh-huh.
asking me who reports to who.
I'm asking you,
Huh?
asking me, yeah.
No, I was stating that I was answering your specific questions. You were asking me who reports to who,
Right.
and I was giving you those answers as to who reports to who.
Okay.
That's all I'm doing.
And,
If you're having this problem or a concern with the physician
uh-huh.
who is taking care of you, your
Mm-hmm.
primary care physician,
Right.
uh, the physicians report off the chief of staff's office.
Okay, and if I'm having a problem with the clinic and the patient advocate and Mr. Masasura, who's supposed to be over the clinic, who's over him?
The chief of staff's office, J. Calabar.
Okay, because that's not nothing to do with my doctor. That's about the clinic operations. That's not my specific doctor.
Dr. Manzazera reports to, answers to the chief of staff, who is Dr. J. Calabar.
Okay, okay. I'm just trying to clarify that because Dr. Masasura is not my doctor,
Yes.
and the people that work in the clinic, the patient advocate is not my doctor. So I'm just trying to clarify that all those people answer to Mr. Am I saying Calabar?
Dr. Calabar.
Okay, okay.
The patient advocate, which is our consumer affairs office.
Mm-hmm.
Michelle Farrell is the supervisor there. And
Hang on.
she has team members that work for her.
What is the extension there
What extension?
to Michelle?
Their direct number, I can get it for you because I don't want to give you a wrong number.
Yeah, because you can't go through the main line. It ain't working. The main line, it just either disconnects on you or just rings busy. So I didn't want to call Mr. Walmart's office again and ask him to send me down there. So
Consumer affairs office is 713
uh-huh.
794
Okay.
7884.
Hey, and you don't happen to have an direct extension there, do you?
That's the direct number.
Okay.
Area.
Okay. Thank you so much.
You're welcome. Have a great day.
You too. I have talked to her before. Michelle, please.
What's your name, sir?
Slade Fuquay.
Fuquay?
Uh-huh.
Is she expecting your call, Mr. Fuquay?
No, ma'am, but I have spoken to her in the last week or two. She said to call her back if I had any problems.
Okay, what's your last four, Mr. Fuquay?
6165.
Okay, hold on just a minute. You said Frank Fuquay?
I'm sorry?
You said Frank Fuquay?
Slade is the first name. Slade.
Okay, thank you. Hold on.
Sure. Oh.
At 713-794-7648. Make sure you have your social security number and your prescription number handy when you call. Have a medical question on the weekend and not sure who to call? The VA Network Telecare Center is open 24 hours a day, 7 days a week, and can be reached by calling 713-794-8985 or toll free 1-800-639-5137. Talk with experienced and knowledgeable healthcare professionals and get answers to your medical-related questions. Want to find out about available VA healthcare benefits and services? Next time you are here, pick up a veteran information packet at the information. Consumer Affairs, Michelle, may I help you?
Hi, Michelle. And I might be mistaken, but isn't you that I spoke to a couple of weeks ago?
I am not sure. Let's pull you up and see. What's your last four?
6165.
No, I haven't spoken with you. How can I help you?
I'm trying to get a point of contact down there that's gonna be like a continuity of my health care that can follow up with all these things that are supposed to be getting done, because people keep telling me things are going to happen and they're not happening.
That should be with your primary care find out who that is.
That's Dr. Ajovu, but I mean, I'm talking about like all of it. I'm supposed to be getting help from this ACT team in the homeless veterans program,
Yes, sir.
and the deputy Tony, told me some things are going to happen, and none of that stuff has happened, and nobody's followed up with it, and I was assigned a social worker and a nurse, and the social worker doesn't seem like she's really following through with the things she said she was going to do, and some of the information that I'm getting back from them is information that I've already found out to be not correct or whatever. There's nobody operating their due diligence down there to follow through with any of these things, and I'm trying to find out what's the status. What is my diagnosis? What is the status on this help? I need somebody to help me with all that stuff, and I got too many doctors and too many helpers down there, and everybody's saying something and nothing's getting done, and I'm not gonna make it. And I'm trying to hang on. I tried to call the crisis hotline today, but they were overwhelmed with calls there, and I'm trying to keep get somebody to help me.
Right. Okay. It looks like you are working with Senator Cruz's office. You followed an inquiry with them.
Yeah, and I haven't heard anything back from those folks, and
So we're working on that. So if you will allow me, Mr. Sequay, let me check on the follow-up response, because on that we should be able to give you a point of contact. Okay, because we're addressing every one of your issues.
oh,
With tax,
oh,
with primary care, with neurosurgery, all of that. So I should have points of contact for you, if you will allow me that, okay?
okay. Well, I'm struggling, to do the things that they're asking me to do, and it seems like I'm in a big loop. I went and saw Dr. Ghosh last Friday, and Dr. Ghosh is the doctor who put me in the substance abuse program and diagnosed me with an opioid dependence when my request for opioids was to treat my back pain, and why he elected to put me in that clinic, I don't know, but that's who they sent me back to, and his response was to put me back into pool therapy, and I've already done all that once, and now I'm just seems like I'm in a big circle, and so
Okay, let me
the
follow up on it and see if we can pull it all together for you.
the ACT team deputy Tony or whatever her name is, she said that they were going to have somebody come over here and install some handicap devices to help me until they could put me into a more suitable handicap accessible environment, and that's been like a month and a half, and I haven't heard anything from anybody on that. So everybody's saying they're going to do this stuff, and none of it's getting done, and I don't have any single point of contact to follow up with this stuff, and that's what I'm trying to do,
Well,
is
that's
to.
trying to work on for you, getting a point of contact, you to be able to get all this taken care of.
And you have any idea how long that's going to take?
I would think we would have it by now. Hang on, let me just see where we're at.
Oh,
We've got 2.7 completed. We're just waiting on primary care.
so that should be forthcoming then pretty directly.
Yeah, once I get that, we should have it all together for you.
And then what should I anticipate then? Is I'll get a letter or a phone call or what do you have any idea what?
This will go back to the congressional office, in which they will also provide you with who the points of contacts are, but I don't have a problem calling you with that either.
Okay, Michelle. Well, I thank you so much today. You've at least been able to alleviate some of my stress. So,
Yeah. It's being worked on, and we're going to get it all together for you.
and I've been calling phone numbers since about 10 o'clock today. As I kind of expected somebody to call me yesterday. And follow up with stuff, and it's just hear from nobody.
They're going to be coming back out to your home on October the 30th at 1 o'clock.
Oh, that's Dr. Allison or whatever.
Yes, sir.
Okay. Well, thank you for your time, Michelle.
All right, you take care.
Bye-bye.
Bye-bye.
Oh.